The topic on our screen today is peritoneal folds, and for the previous videos we have talked about the peritoneal cavity and its folds, but now we'll be talking more in details about the peritoneal folds, and I'll be giving you some interesting mnemonics that can help us remember the peritoneal fold in details and looking at some of the easy questions that can be asked about the peritoneal fold. Now this easy question says, give an account of the lesser sac of the peritoneum and add note on its development. The question can also be on the greater peritoneum or any other peritoneum in the body. So today we'll be diving into the peritoneal folds. I want you to sit back and listen. Now, here's a mnemonic that I've created. I told you for all cavity, all spaces, and canals. We can use this mnemonic ABC for to know. Now, for peritoneal fold, I would like us to know that we can also use this mnemonic for the peritoneal fold. But in this aspect, instead of using boundaries, we're using attachment and origin. Attachment and origin. So for the peritoneal fold, we started with the greater omentum. Omentum, we have said that the omental is the connection between the stomach and the organ. And when we talk about the greater omentum, we're talking about the connection between the stomach and the transverse column. So the omentum is a large, thick peritoneal fold hanging from the greater curvature of the stomach and the duodenum, resembling an apron, and so it hangs from the greater curvature of the stomach and the duodenum. It has 4 layers of peritoneum that fuses into a thin fenestrated membrane with variable fat content. So the attachment of this, the anterior 2 layers descends from the greater curvature of the stomach and then fold on themselves. The posterior 2 layers ascend to the transverse vesiculum, blending with the peritoneum over the transverse vesiculum. So it folds on itself on the posterior layer, then it now moves down with the posterior layer to attach to the transverse vesiculum. So this is what we're talking about, the greater omentum. You can see it has 4 layers, and the 4 layers fuses to form 18 fenestrated layers that connects to the transverse vesiculum. Okay, I want to let you know that the fact that the greater omentum has 4 layers can be asked in your multiple choice, so you must take note of it. That the greater omentum has 4 layers. The first 2 layers, we call the anterior 2 layers will descend and fold among the fold backward to join the posterior layer, down, descend, and connect to the transverse column. Take note of this. Can be asked in your multiple choice question. Now, for the content of the greater omentum, it has the adipose fats. It has the milky spots, it has the macrophage aggregation aiding in immune response. It has the vessels, which are the right and the left gastroepiploic vessels that runs near the greater curvature of the stomach. So any mnemonic here can help us remember this content of the greater omentum, which is femur G. But if you want to shorten it, it can be FemG, because FemG can also give you the full mnemonic that will help you remember the content of the peritoneum. So we have the fats at famous F, A, aggregation of macrophages, M, macrophage, or milky spots, O, omental vessels, which are the right and left gastroepiploic vessel, U for underlying skeletal tissues, S for serous membrane, and G for gastroepiploic vessels. So FemG, which will be shown on your screen now, can also help you know this without trying to know the whole famous G. So FemG, fat, adipose, aggregation of macrophages, milky spots, which is something aggregation of macrophages, and gastroepiploic vessels, which is the right and the left gastroepiploic vessel. Now, for the functions of this greater omentum, the fat there serve as energy. It has serve as energy reserve. The macrophages there will help in infection defense. So it is called the policeman of the abdomen that limit the spread of infection by sealing off the infection area. Now, it is also called the policeman of the abdomen because it covers the abdomen, so it limits the spread of infection by sealing up the infected area. Now, we can use it as a graft, like When we have surgical graft material, we can use the peritoneum as a graft. We can also also act as a protective shield to the abdomen and the viscera during a blunt trauma or a blow to the abdomen. So it can act as a protective shield to the abdomen. So finally, it helps us for compartmentalization, which helps us to divide the greater sac into a superior into the superior and inferior colic compartment, and we'll discuss more on this in our next video. Now, for the mnemonic that will help us remember the function of greater momentum, we can use PIX, PP, PIX, double P, PIX, double P. P, protect the viscera from external trauma. I, isolate infection, that's out of the policeman of the abdomen. G, grafting material for surgical use. S, stores fat. P, prevent the spread of infection. And P, the second P, partition of the peritoneal cavity into supracolic and infracolic. So with this mnemonic, we can know the functions of the greater omentum. Now, the next one is the lesser omentum. From the greater omentum, you can see that this mnemonic A, B, C have helped us to know more about the greater omentum, because it gave us all we need to know about it. Yes, so all we need to know can be the definition and the function. Then it gives us the boundaries where it's starting from the stomach and is attaching to the transverse 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 column, and it has four layers that fuses to form a thin fenestrated end that continues with the peritoneum of the transverse column. It also told us the contents of this greater omentum, where it showed us that it has the fat, famous G, fat, it has aggregate of macrophages and the milky spots. Then G, it also contains the epiploic vessels. Now that's the content. Clinical coloration, they can be it acts as the policeman of the abdomen, so it can isolate infection in that area and prevent the spread of infection. So these are the mnemonics that can help you know the high yield concept about gas that can help us know the high yield content about greater omentum. I know you love this mnemonics to help you. So if you love the new ways that I've just released, like this video, share, comment, and refer others to the video to gain more insight about the greater omentum and the mnemonics that can help them remember the high yield concept of the greater omentum. Thank you. Thank you for watching.